Mumps is a contagious viral disease that primarily affects the salivary glands. We don't really see mumps very often today because of widespread vaccinations in the US, but outbreaks still occur. Mumps is caused by the mumps virus, which is also known as MUV. This belongs to the Rubella genus within the Paramyxoviridae family. This is an enveloped single-stranded negative sense RNA virus, and it has several proteins that makes this virus so easily spread. So the HN protein, this allows the virus to attach to receptors on host cells. We also have fusion F proteins, which fuses the viral envelope with the host cell membrane, and this allows the virus to enter the cell. And the V protein, this interferes with the host interferon response, meaning it reduces the body's early antiviral defenses. The mumps virus is important because humans are the only natural host, meaning there isn't an animal reservoir that normally carries the virus. This disease is best known for causing inflammation of the parotid glands, which are the largest salivary glands and are located just below and in front of the ears. And when these glands become swollen, they produce the classic puffy cheeks appearance that many people associate with mumps. Mumps spread through respiratory droplets and direct contact with saliva. And then after entering the nose or mouth, the virus first replicates in the upper respiratory tract and nearby lymph nodes, and it then enters the bloodstream, which this allows it to spread throughout the body, especially to the salivary glands. One reason mumps spread so easily is that people are contagious before they even realize they're sick. Individuals can be contagious, and they're actually most contagious from about 2 days before the swelling begins, and this lasts until about 5 days afterwards. And it has an incubation period of 2 to 4 weeks, so someone can be infected for quite a while before symptoms appear. For the diagnosis, doctors often make this based on the clinical signs, especially the characteristic swelling of the parotid gland. However, the diagnosis can be confirmed, and this can be done either through RT-PCR testing, which detects the viral RNA, or serology, which looks for the antibodies against the virus. The symptoms and signs usually develop in stages. So during the first 1 to 3 days, this is when patients experience general flu-like symptoms. So a fever, headache, muscle aches, fatigue, malaise, very general symptoms that are similar to a lot of other viruses. However, as the infection progresses, usually around day 3, we can see some inflammation of the salivary glands, leading to the swelling of the jaw and the cheeks that I was talking about. We also see pain while chewing or talking, ear pain, swelling beneath the floor of the mouth. Some patients even experience a sensation of like the feeling that everything tastes sour when you're eating. So no matter what someone is eating, the parotid gland is so inflamed that it contracts just as it would do whenever we eat something sour, and it produces a lot of saliva. The swelling typically reaches its peak between day 3 and 7. While most people recover completely, we do see cases where mumps becomes more serious. And as I said before, the virus can enter the bloodstream, and as it spreads to different parts of the body, it can include the central nervous system. Some important complications that has been seen are encephalitis, which is the inflammation of the brain, sensory neural hearing loss, and orchitis. Orchitis is the inflammation of the testicles in males, and it can occasionally affect fertility. In rare cases, patients may develop long-term sequelae such as paralysis, seizure, cranial nerve palsies, hydrocephalus, or permanent deafness. Fortunately, mumps is rarely fatal, especially in countries where supportive medical care is available and where we have vaccinations. There are no specific cures for mumps. There's no antiviral medication that can treat mumps, and instead the treatment focuses on supportive care, which this includes rest, hydration, pain relievers, antipyretic medication, anything that can make someone feel more comfortable while the immune system clears the infection. Those who are infected should also isolate themselves for at least 5 days after the onset of the swelling to reduce transmission. The most effective prevention is vaccination with the MMR vaccine, which also protects against measles and rubella. There's the recommended dose is 2 doses, which this leads to strong protection and have dramatically reduced the number of mumps we see worldwide. Here there is a chart with the amount of cases that we would see before the vaccination, and there's an obvious, very dramatic decrease in the amount of cases that we see in the US after the vaccination was implemented. We still see some outbreaks every now and then, but it's nothing like what we used to have. As of right now, for 2026, we have only seen 117 cases of mumps in the US. Another important way to prevent the spread is with good hygiene, so washing hands, making sure that you are not sharing utensils or cups or anything like that.